Andrea Dempsey. And ladies in your 40s and up, you're going to want to listen because her medical practice, juvemd, located in Summerlin, is dedicated to helping women manage the life-changing effects of menopause. And don't let anyone tell you that they are not life-changing, because they are. The brain fog, the inattention, the hot flashes, the changes in your sex drive, and the way society looks at us differently once we get to a certain age, it's a lot. If this is you, I really recommend listening to this segment. Dr. Dempsey is a board-certified internal medicine physician that has been practicing in Vegas since 2007. But seeing the need for women in various stages of menopause, she shifted her practice from internal medicine to helping women with balancing their hormones, losing weight, and living their best lives. We're so happy to have more of this in town. And Dr. Dempsey, thank you so much for being here.
Thank you, Kim. I am so excited to be here. This is my passion. I do this full time, hormone replacement therapy for women and men. And women are not crazy. Like, we were told that our brains are not working the same way, our bodies don't feel the same way, we're not aging the way we want. And so I made it my practice to do the research, go to the education, and find out more about what is available for women. Over the past 12 years, I've done a lot of hormone replacement in the world of bioidenticals, but most recently I changed my practice even more so to deal with pellets, and I've seen a stability in my patients, happiness, and it's really just my full-time passion.
All right, let's talk about this some more, because this topic is really near and dear to me. This feeling like you are going crazy, which is something that I think a lot of women in perimenopause and menopause talk about, where you just don't feel like yourself. And a lot of times you'll walk into a doctor and they'll say, oh, that's just stress, or you're too young to be feeling that way. And it feels like this universal experience that women have when their symptoms start. So talk a little bit about how important it is for women to have access to doctors who get their experience. And how important, I'm just going to do that again, Anthony. How important is it for women to have access to doctors who get their experience? And how do you, do this with women? And what makes it different for you?
I think starting first and foremost, it's compassion. I mean, perimenopause can start in their early 40s, and menopause on average in the United States could be 51. It's a long time for women to be experiencing this, in addition to our regular stressors. But to be told that we're not doing well because we're under stress or we're not getting enough sleep, and then compounding the fact that estrogen does have a physiological benefit for our brain, and even more so, there's studies right now that are showing the benefit of estrogen on the brain. So going back to finding a doctor that will not just piecemeal together your diagnosis, something for your sleep, something for your mood, something for your achy bones, and thinking that that piecemeal approach is actually going to help you, and not entertaining the idea that hormones are driving a lot of these symptoms, and that actually can help women get motivated, can help them to sleep better, to exercise better, and then their bodies actually feel better, so that's, their relationships improve. So I do think that finding a doctor that isn't just going back to the old research and just afraid to even entertain the idea of hormones is like the first step. And then finding a doctor that is compassionate to look at the history, look at the patients as people that are going through a lot of things, and noting that over the next, say, 10 to 14 years, the labs will change, the circumstances will change, and the doses could change. So it's not a one-size-fits-all approach, for sure.
Wow, this is amazing. Can you talk just a minute about the research that most of us are aware of that says that having hormones is detrimental, that it can increase your risk of cancer? For people who are on the sidelines and wanting to think about this, but are worried about, that particular research, has that been debunked?
A lot of it has. I would just say the last 16 years of my practice, I've thought a lot about this Women's Health Initiative that came out in 2000, because I was sort of like that black sheep thinking, well, it's just not adequate to discuss all women when the average age of that study was 63 years of age. Women starting hormones that at that age, 10 years after going through menopause, was just not an adequate sample of looking at perimenopausal women and women entering into menopause. And in fact, some of this has been debunked to show that within the first 5 years of menopause, using hormone replacement at this time is actually giving the most benefit to the heart, potentially up to 40% reduction of cardiovascular disease.
Amazing.
And also the brain benefits. And so now they also did not look at bioidentical hormones, which is using hormones that are identical to what our body produces, like estradiol instead of synthetic estrogen, and medroxyprogesterone, which is synthetic progesterone. So I think it's limited. The study was limited, and it also gave the impression that everything that was found in that study, including the potential smaller risk of invasive breast cancers, were, for everyone to be concerned about. And the real negative part of this, the real negative impact, was that many doctors just refused to even discuss hormone replacement therapy for their patients.
Yeah,
24 years, it's a long time.
That's a long time. And it really had like an amazing amount of damage, I think, in how women really view these kinds of treatments. Okay, so you mentioned bioidentical and you've mentioned the pellets. Can you just get really nitty gritty and explain what are the pellets, what are bioidentical hormones, and just give us like a rundown on what we should expect when we come into the office?
Okay. So blood work is essential. I mean, for anyone saying that it doesn't really tell us anything, it does. So looking at an extensive panel, estrogen, follicle-stimulating hormone, testosterone, thyroid, and then bioidentical hormones are those identically made to like what our body makes, so estradiol, testosterone, progesterone. So you can replace those in other forms, creams, patches, gels, injections, and I did that for many years until I decided to go to a conference as I was told that the testosterone benefits were superior to the prescription medication for bone density treatment. I thought, I've got to hear this conference.
Yeah.
And I was just floored. There was a ton of research. I mean, it's not FDA approved in this country, but the testosterone research is going to come. I know it will. And so the pellet delivery mechanism is interesting because it is a small procedure performed in the office by me. The little tiny grain of rice of, say, testosterone or like a sesame seed size of estrogen will go under your skin every 4 months. It's really well tolerated, and then it leads to a stability of these estrogen and testosterone levels because of the way that the delivery system. So it's cardiac output delivered. So every time your heart pumps, you're getting a little sampling of this testosterone and estrogen. Progesterone can't be delivered this way. It has to be done in a pill. However, like the blood work that I've seen and the advantage to this, because I was comparing and contrasting all of these years of patients' symptoms and changing these little doses of creams versus just tailoring these pellet doses, I thought, this is really incredible. So over the next 6 months of trying on myself and my other patients, I made the change to my practice to do this full time, and here we are like 5 years later. I'm excited. It's really exciting.
Oh my gosh, this is amazing. This
really
gives me so much hope as a woman who, is in menopause now. And for years really struggled not knowing how to handle the changes in my body. So this really makes me excited. We had a bit of a discussion beforehand, and you told me this little nugget of information that I thought was really interesting about how the thyroid interacts with all of these things happening. Can you talk a little bit about the thyroid and how it's going to impact menopause and those kinds of things?
Definitely. So it's a central, controller of our body. And even when I went to med school, we learned that thyroid stimulating hormone was adequate to look at the way that it was stimulating our thyroid to make enough of this T4 and T3 that would then carry us to the rest of our life. If we were low thyroid, then we only had to look at this one measure when replacing it. And somewhere along the line, many years ago, I started to research with another endocrinologist, and I've read a lot of his research, Dr. Antonio Bianco. He wrote a book, Rethinking Hypothyroidism, about the importance of actually looking at T3 and managing T3, because menopause, weight loss, stress, all of these things affect our ability to convert from T4 to T3 in our body. And to only think that we're going to get out of this phase, similarly, we're not going to get out of menopause, we're just not going to replace our thyroid hormone adequately, necessarily, by ourselves. So I've always entertained the idea of putting T3 into the mix, because just treating hormone replacement therapy like the estrogen, testosterone, progesterone doesn't always lead to the success stories. And when I went to this conference in Texas, that's exactly what they put together as their kind of happiness to the equation, was that women will eventually kind of like flatline. And if they looked at their thyroid, they're like, oh my gosh, it looks like their thyroid is the one missing link. And it can change. So we have to continue to monitor the thyroid and address T3 levels to an adequate level, not over medicating patients and not treating people like it's a way to lose weight. And the symptoms that many people think are going to be given when people take thyroid is just not the case. So
wow.
it actually improves a lot of things.
This is amazing. And can you tell the women out there a little bit about testosterone? I know there's people who are going to be thinking, I'm going to end up growing a beard. Mm-hmm. My voice is going to change. What are the effects of testosterone for women at this point in our lives?
Yeah, we definitely need testosterone. We have testosterone in our body. And so when I look at a blood work that shows that women have no testosterone, I think they must be struggling mentally. The clarity, the exercise tolerance, the ability to kind of take on new tasks. It's not just estrogen benefits. And so I have seen in my practice, it's the magic. I think we talked about that before when we were speaking. It's like the magic.
I love the magic. I love this idea of testosterone as this little bit of magic.
Little bit of magic.
Oh, that's so good.
It's not only the libido changes and the improvement to vaginal dryness and sometimes urinary tract improvement. It's also just our brains handle stress better with some additional testosterone, not man levels of testosterone. And we look at these levels and we carefully monitor. Every time someone comes in, they're basically getting some type of lab done. And so it's a one kind of pellet for your height and weight and your labs. It's not everybody gets the same dose. But the bone density improvement, amazing. Lean body mass, it also helps patients lose weight a little bit better just because of the way the testosterone works in our system. So it is a little bit of magic in there. And I think everybody should find a doctor that's willing to entertain. It could be topical, although I don't believe any longer that the topical works as well as the pellet.
You don't?
So I don't.
You don't? Okay.
Yeah, I've seen so much variability in the blood work, also just how people respond to the cream, and I've never entertained doing injections in women because I just think it's a peak and valley of levels, whereas the pellet is very, for my patients, very steady state. And it's the one thing that I know patients come in every 4 months, they're like, I couldn't go without this. I cannot believe I lived without this. I used to do these like creams and patches, and this is just like life-changing. It really is.
Wow. And did you find that testosterone had like a real influence on like sexual desire, which we know can be very challenging when you're in menopause? Did you find that it helped that?
Definitely. I mean, more so in the form of a pellet than the creams. And that's why I just think that, it's hard for me to talk people out of trying a pellet of testosterone. That really isn't a good option. So when patients say, I cannot believe, like, my relationship is so much better because now we can have this dialogue and I don't feel so bad about myself, and then I worry about my partner, the way they might feel about me not entertaining. My libido is so low, and then I'm tired all the time. And so, yes, I feel like I fixed a lot of relationships. I'd say that because I hear it all the time.
I love it.
I can't believe it at any age, like a 65-year-old woman. It's like it. Yes, so and I also do hormone replacement for men in the form of pellets. So I feel like it's important to talk about the sexual side effects and the sexual and benefits of hormone replacement therapy, and it's definitely part of our dialogue in our office.
Oh, absolutely. And I think it's one of the most important parts of it because we are sexual beings, and then you get to this stage in life, and then all of a sudden things just shift, right? And so this is just to know that there are options out there, that you can talk to your partner, that you can, think about how to make those things better and have those really strong relationships going into sort of the last third, of your life, I think is really critical.
That's good. And unfortunately, testosterone is only approved, if it is approved, sort of slightly in this country, for the treatment of sexual dysfunction in women. And that narrative has to change. Because we have to have some studies where we show that, this is good for our brain and our bones and our heart, just as it is for men. So there are some studies on the benefits for testosterone in men. They just don't have these studies for women. So we shouldn't be just told that we should need testosterone because our libido is low. And so that's the future, I hope, for research. I hope that some of the brain researchers that are doing research on estrogen on the brain are also going to consider doing some testosterone. It's hard when it's not FDA approved. It's not available at your pharmacy to get. It might be difficult, but not impossible to do a study. Maybe overseas. I don't know. We'll see.
Do you don't see that happening here, or do you have hope that will be?
I have hope. I just don't know. I'm not sure.
Right. right,
Yeah.
right.
Yeah.
That makes sense. That makes sense. I wonder, do you know if testosterone improves like symptoms of ADHD in menopausal women?
That'd be great. I've always wanted to do a questionnaire now that we've done like over 3,000 of these procedures, and just rate, anonymously, I rate how people benefit in those 4 months. Most people, I would honestly say, most people say it's brain clarity and ability to deal with stress. Libido is definitely there, but that's like they realize at the first pellet and then they kind of like, yay. But as it keeps going on and as the pellet say wears off and they're due for the next one, they're like, I can't go without this. I feel like I do better at my job, my relationship, handling stress, multitasking better. And so I do wonder about that, attention deficit part of it, because that would be a fantastic way to look at it. I've really always wanted someone to take on studying bioidenticals, particularly pellets, in a younger population around transitions of postpartum and different times where there's much more severe hormonal shifts, to see whether the delivery system would work out better and help people get through these challenging times that are linked to hormones, but really not entirely proven, and we often use just antidepressants, right? So
Right.
That's
Absolutely.
my kind of interest. Yeah, for sure.
We're like treating the symptoms, but we're not really treating the root causes, right? So nothing really ever gets solved. And I'm really blown away by this interview today, Dr. Dempsey, because this is like, I feel like we've been ignored. Older women have been sort of ignored in the research. And so just having a doctor who's really tuned in to what women need at this stage just feels really amazing to be able to have that. And I so appreciate you doing this work, changing your whole practice in order to do it. And so if you just to take us out, can you talk to the women who are in perimenopause and menopause who are struggling right now? They're experiencing the brain fog and their sex lives are changing. Give them the next steps.
So next step is like, you're not alone. It's not just a phase you're going to have to get through. Yes, it could be a change of job or relationship, so there are stressors, but there is a doctor out there that will listen to you. And although there might be some options for some other prescription medication, at least ordering your blood work, at least entertaining that this isn't something you might just have to pass through and struggle. And if you could find a support group, I know now on my socials it's all over with menopausal discussions and perimenopause. So I think we're getting supported, and I know women do really well when we get together and we talk about things. And I think debunking some of the Women's Health Initiative study is helping. So the next step would be, don't take no for an answer. Find the right provider, get some blood work, do some reading. So I'm sure there's going to be more and more, even not reading, podcasts. There's going to be tremendous amounts of podcasts coming up, I know. So I think there's going to be more options. I'm very excited, super excited about this field. It's about time.
Yes. Dr. Andrea Dempsey, thank you so much for joining us today on CityCast. Everybody check out juvemd, and located in Summerlin. And